Everyone, American nurse living and working in Sweden. So sorry it's been a while since I put out any content. I've been extremely sick and was even hospitalized. And that's what I wanted to do this video about. So those of you that follow me know that I have about 15 years experience. I've worked in many different departments in the United States. I've even been a patient in the hospital, and I've experienced care both in the hospital setting and in primary care. I've been experiencing healthcare in primary care here in Sweden, and now I have my first experience being a patient in the hospital. So I thought it'd be really interesting to do a little video about that and kind of talk a little bit about my anecdotal experience. Now, as I said, this is an anecdotal experience, and so each person is going to experience healthcare through their own lens, through their own filter, and so your experience may not be the same as mine. So I'm not saying that one is better than the other. I'm just going to kind of relate my story. And I'd love to hear back from you guys if you've had some similar experiences. How did you experience healthcare in America versus in Sweden, or maybe some other European country? So first off, I'm not completely better. I'm actually still fighting an infection. So what happened was I had a wisdom tooth on this side that needed to be pulled. And it was one of those things where for a long time that, we've been saying, it's not giving me any trouble, it's stable, but eventually I need to get taken out. In fact, I need to get the other one taken out. I still have that one in because they were impacted. They were laying on their sides. They were covered by bone and gum tissue, and they had pockets. So there's no way that you could clean them. And so there were these little cysts that were encapsulated. I've been to many different dentists in America, and they basically said, well, it's not giving any trouble now. It's stable. It's not impacting the other teeth. There's no pain, so let's leave it. But later on, you'll probably have to get them taken out. The other concern was the one on this side is laying directly on top of a nerve. And so there is a risk associated with that. I could be paralyzed, lose some sensation, lose some movement there in that jaw. And so the idea was just let's put it off for as long as we can. Well, then I come to Sweden. I've been here for 3 years, and those cysts that are there in the pockets between the teeth were getting bigger and bigger, and it was getting to where now I've also, I have had braces, so my teeth have moved around a bit. So the wisdom teeth were starting to push on the other teeth, and the concern was that it's going to damage the other molars that I had beside the wisdom teeth. So the decision was made, and I had a second opinion as well from another dentist at another place that I should have them taken out. So I got a bunch of dental work done. I had some fillings done, tooth cleaning, and then it was time for my surgery. I was told who the surgeon would be. He had extremely good recommendations. I think the dental thing, I can probably make a whole nother video about that. I don't really want to go into that too much on this video. I want to focus more on the aftercare of the complication from the tooth removal. So anyways, he was extremely sterile, more sterile than I've ever seen in America. That's one thing that they pride themselves on, I think, here in Sweden is hygiene. So they did a real good job of, having a sterile field, draping me in sterile material and everything. However, there was that cyst. So there's fluid in there, and there was a risk for infection. So they took the tooth out. He said it took a little longer than expected, but it wasn't terribly hard. So it took an hour. He said take 30 minutes to 2 hours. Got it out. It was really relatively painless procedure. I was very satisfied with how that all went. He said, we'll call you later. So this was a Thursday night a couple weeks ago, about 3 weeks ago. And he said, we'll call you the next day, see how you're doing. But if you have any trouble, we don't have an on-call doctor, so basically you're going to have to go to either like a healthcare clinic or you're going to have to go to the emergency room if there's a complication. But he said it's extremely rare. He's taken care of 1,000. He's pulled 1,000 of these teeth, and he said he's only had one complication, and it was something that, got better with time. It was a guy who apparently had a little bit of numbness in the jaw, and then that went away. Like I said, this guy was extremely well recommended. If you look at the reviews, it's just tons and tons of good reviews. I've worked with the other people on his team, and I hate going to the dentist, but I actually like going to this place. Like I've literally fallen asleep and almost fallen asleep in the chair when they're working on my teeth. So I feel very comfortable with them. So there was no concerns there. So then they call me on Friday because I'd had it taken out at 4 o'clock p.m. the day before. And then they call me on Friday and they're like, how are you doing? And I had some swelling, but that was to be expected. They don't like prescribing antibiotics and they don't like prescribing pain meds here. So that's a kind of an issue, I think. And now that I don't want to get too much into that just now, but apparently that's kind of their standard and their guidelines, and they have rationale for that. So I was basically just told to take the Swedish version of Tylenol, and I was taking it like candy. I wasn't taking more than you can take because you can only take a total of like, I think it's 1 gram 4 times a day. So it ends up being like 4 grams a day if you don't have any liver trouble. And then on top of that, I was taking ibuprofen, and it was just barely getting me to where I was comfortable. And so I mentioned that, and they're kind of like, well, that's to be expected. Just keep taking it and stay on top of it. Don't miss a dose. I still wasn't on antibiotics despite the fact that I'd had that cyst with the fluid. Well, then Saturday comes around. So now it's been 36 hours, and of course the office is closed, and the swelling was getting really bad. The pain was getting really bad. I started having low-grade fever. So I talked to a friend of mine who's a dentist in Sweden. She's actually worked here and she's worked in Sweden as a dentist. So it's interesting too talking to her because even Iceland has their own guidelines, and America, Iceland, and Sweden, they've all got their evidence-based knowledge that they're pulling from, but they interpret the data differently and make different protocols and guidelines. So anyways, she said, you'll be fine probably, but if it gets worse, then you can actually go to what's called Folktandvården. So it's kind of like a community health dental clinic, I guess you would say. So it's like affordable tooth care, and that they had emergency hours the next day on Sunday. Because I think by the time I talked to her, it was already getting into the afternoon, so it was too late to do anything. She recommended not going to the emergency room. I was starting to get kind of nervous. I just had this gut feeling that something is going to go wrong. And so she gave me the number. She said, you can call them in the morning. Maybe they can look at you and they can give you some antibiotics if you need them. Sunday, I was really sick. So I called them that morning on that emergency line, and then they got me in. But, I had to wait for a few hours, 3 or 4 hours, because, it was like everyone that was there for emergency visits. So I waited for about 3 hours, finally got in, and immediately when they looked at me, they said, you have a serious infection going on. The side of my face was like all swollen up. It was starting to go down, like I was starting to feel like a little tender here in the side of my neck. And so when they barely pushed on it, a bunch of pus started coming out. Sorry if I'm grossing you guys out. But so they said you need to be on antibiotics. So they put me on 2 different ones. I got Flagyl and I got penicillin. And so I went immediately to the pharmacy, picked it up. That was 2:30 in the afternoon. Right after that visit, I took the doses of that. I was taking my pain medicine, the over-the-counter pain meds. And then within 2 hours, I started getting really sick. I started having chills, and I was like, okay, I think it's going to take a while for this antibiotic stuff to work, because it's tablet form. It's just got to build up in the system. So I was, being a nurse and working in the intensive care unit, I've seen teeth problems get really bad. I've seen a lot of younger guys in their 30s that I had taken care of that ended up having to be hospitalized and ended up unconscious, got into sepsis and they were intubated and have had like major oral surgery and drains and stuff. So I'm sitting there thinking worst case scenario. And so I talked to my friend, and it's kind of like, well, it was just hard, to figure out like what to do. She saw the pictures and she's real supportive of the whole thing. But basically the thing I kept hearing from her and other people in Sweden is I just had bad luck, that this is very unusual. This shouldn't have happened. And so I was feeling really sick, and I'm like, I feel like I need to call the Swedish version of 911, like for the ambulance, 112. And but I felt like I don't want to abuse, the resources here. I'm so used to, like, in America, like an ambulance ride is like, it could be $5,000 to $10,000, I've heard. And so, and then the insurance won't even pay for that. So I'm like, I don't want to abuse the system, and it may not be as serious as I think it is. I may be blown out of proportion, but I do need to be in the emergency room. And I was just dreading going to the emergency room because I remembered how it was in America, where you go there and you're waiting for a long time, for anything to happen. And it's like organized chaos in America in the emergency rooms. You got people laying out in the hallways. There's just not enough beds and stuff. So I'm picturing that, and I'm like, I really don't want to go in there. And then, so I texted my friend who he's lives here in Sweden, and he's kind of like my primary contact. So if anything happens, because I have no family here in Sweden, so if something happens to me, then he can call my mom and let her know, what's going on, and vice versa. So I called him. I said, I'm going to go to the hospital. So I was planning on taking the bus, which was like, it was going to be like an hour ride walking to the bus, taking the bus, walking to the hospital. And he said, I'll take you there in the car. So he picked me up, took me there, and I felt so bad. So as soon as, and this was the number one sign for me why I needed to be in the hospital. At the side of my neck, I started getting like red streaking lines going down towards my heart. And I thought, this is not good. I'm going to go into sepsis here. This is life-threatening. And it was spreading really fast. So I didn't want to get blood poisoning. And so I went into the emergency room, and as soon as I walk in the door to the emergency room, I just told them, I said, I feel really bad, and I think I'm going to go into sepsis right now from a tooth infection. They could see I was like so swollen. They were so cool. It was such a good experience. They just handed me a piece of paper that said, write your name down, your phone number, your primary contact, and their phone number. And then go over to the window. They put an armband on me. So in 5 minutes, I was already had an armband on me, and I was walking to a bed. I just couldn't believe it. And then within like 15 minutes, they already had all my vital signs taken. They were already taking blood tests on me. The gentleman was so good. He wasn't a nurse. He was, I guess, to be like the equivalent of an LV in America. He was so gentle and so kind, and I just felt so comfortable with him, which was great in such a scary situation. And he even put an IV in me, and I didn't even know he had the IV. I thought he was just taking blood, but he had already inserted an IV. He was just that good. And, they decided that what they were going to do is I was going to go into sepsis if I didn't get treated, but I wasn't quite there. I was kind of like borderline. I had high blood pressure. I had tachycardia, fever, nausea. My CRP was elevated. Had all the streaking from the infection going on, and it was not good. So anyways, they said, we're going to send you over to the other ER unit, the other triage area, and you're going to sit there and wait for an ear doctor to take a look at you. So I was shocked because I'm thinking this is a Sunday night, so I was worried about, is there going to be enough resources of people to take care of me? Wasn't a problem. So I waited probably 30 minutes to 45 minutes for a doctor. By this point, I felt terrible. I was sitting in a chair waiting for her to see me, and she was working with another patient. So as soon as she got done, she called me in. She was fantastic, super kind, wonderful bedside manner. Again, I mean, I just have to say this over and over and over. Coming from America, one thing I'm so proud of as an American is customer service. I feel like in many ways, customer service is way better than here in Sweden. There are outliers, of course. But I have to say, when it comes to patient care, I feel like my experience has been way better as a customer than in America. You just feel like they really do care about you. They're very kind, nice sense of humor, good morale. And I saw that not just towards me. I saw how they were treating other patients, and they were just phenomenal. Everybody. So anyway, the ear doctor takes a look at me, and She said it was pretty serious, so she put some anesthesia in my nose and put a tube down there to take a look and see if my airway was okay. She said my airway was safe, but I was pretty bad. So she needed to get a CAT scan of my head so that they could see what was going on, because she said we need to like empty out all this pus that was starting to build up. So they put in an order, and I think it only took, they started me on some fluids, and that started helping because my appetite was really bad. I was having trouble eating. I couldn't open my jaw hardly because I was so swollen. I got the fluids and waited for a CAT scan to come. So they came pretty quick. And then the ladies in CAT scan were just fantastic too. They were so, that's one thing too I noticed in Sweden. They're so good about telling you every step of the way, we're going to do this, we're going to do that. So you're able to prepare. So for someone like me that has a lot of anxiety disorder, that helps me because then I can kind of prepare myself for what's going to happen, and I feel really safe. So yeah, I got the CAT scan with contrast. It wasn't a bad experience at all. Then I waited for the results to get read. So within coming to the ER and having all that stuff, I'd say probably 3.5 hours, I was already back in the ear doctor's chair, and she had the results, and she was going to empty out the pus, the abscess that I had developed. And I have to say that was it wasn't her fault. It's just the nature of the beast. You can't really properly anesthetize an abscess because you got all that fluid, and so you're just injecting, it's getting all mixed up in the body fluid and everything. So she did the best she could to anesthetize, but it hurt like the dickens. That was the worst pain I have ever had in my entire life up to that point. And there was just nothing you could do. I mean, I was trying to sit still, and I was about to just come out of the chair, banging my fist on the arms, kicking around. And then she's like, "You're doing really good. I couldn't have done what you're doing." Yeah. So she understood it was really painful, and she was just real patient with me through the whole thing. I'm like, "I'm so sorry. I just couldn't sit still. This is just excruciating pain," when she was trying to press the stuff out. Because think about it, I just had surgery a few days ago. It's not healed, and now it's inflamed and infected and everything. And within probably 30 minutes of her doing that, I felt 80% better. And then I was getting the fluids, so that was making a difference. And she said, this could have gone bad really fast, but I got there just in the nick of time. And she said, usually with teeth things, they go bad really fast, but they get better really fast. So she felt that I could stay in the ER and be admitted there for several hours for observation, but I didn't need to go to like an infection department and be admitted there. So she said, we'll just admit you here, we'll watch you, and then if you're doing okay, then early in the morning we can send you home. So that's what happened. I went home and I just felt so much better. Still super sore and everything. Then I went home and I slept for a couple hours, and then I woke up with horrific chills, so bad it was almost like a seizure. And then my mouth was so swollen, it was worse than when I went to the ER. By then I guess it got inflamed from getting everything pushed out and stirring up all the infection. And so I bit my mouth really bad. I could not control the shaking. It was, like I said, it was like having a seizure. So I started bleeding really bad. And but what she had done was she said, I'm going to send in a referral so that Monday morning a specialist, a jaw surgeon, can take a look at you, and then we can go from there and see if you need to have it emptied again or some other interventions. And they'll look at the CAT scan. So I'm sitting there freezing to death, sweating, fever, and I'm thinking I need to call an ambulance. But then at the same time, I'm just going to go back in the same thing. They're probably going to do the same thing. I would rather have someone who that is their skill set that they deal with all day, is working on people's jaws, to take a look at it. So I thought, I'm stable right now. My blood pressure is sort of stable. Heart rate's sort of stable. I'm breathing. So I'll just wait until they call me between 8 and 9. So they called me, and I told them I was feeling really, really bad, and that I was tempted to go into the hospital again. And they said, well, it's up to you. So I took the risk, and I went ahead and went to the jaw surgeon. And so they got me in an acute, they call it acute T, so it's like an emergency time. And they were looking at it, and my case must have been so interesting because there was like 7 or 8 people standing around, and everybody wanted to participate in my care. But they were really cool, really funny. We were having some good laughs, which was nice in a stressful, scary situation like that. Basically, their thought was, but because enough time had passed that I'd had, half a day's worth of antibiotics put in me. And their thought was I just needed some time to heal because I'd just had surgeries a couple days ago, and then they pressed on it and got everything all irritated, and I just started antibiotics. So they said, we're going to let it just kind of rest, and then you can come back in 2 days, and then we'll go from there because it's just going to make it worse. And if anything happens, call the ambulance. So I went home. I got a tiny bit better, like maybe 10% better. But I was just not well. Barely could eat, couldn't open my mouth at all. I mean, I was having trouble eating, taking the pills. And so I come in there and they're like, man, you probably should have called us like the next day to come back in if you were this bad. But I didn't know. So anyways, so they took a look at me and they said, yeah, we're going to have to open you up and clean this all out. So whole bunch of people come in the room. It was a good learning moment for them. They opened it up and they just cleaned it all out. And, I said that the experience in the ER was the most painful I've ever had. That became the second most painful because this was even worse because they had to like take all the stitches out of all the surgery I just had a few days ago, clean it out. And then they made like a little drain out of a rubber glove. I've seen this done in America before where they take it and roll it up and they put it in so that the stuff doesn't stay in it was in my cheek, so it could drain out. So they did that, and it made a huge difference. And they said, just keep taking your antibiotics. But by then I was in just so much pain. They did not prescribe pain medicine. There was just such a huge aversion. Like, you really have to advocate for yourself in Sweden. And if you need some pain medicine, you have to like almost beg for it. Whereas in America, they're very prophylactic. They'll just write, it's kind of like, well, generally speaking, this kind of pain medicine works. You're probably going to need it. And then that way you don't have to go to the emergency room. I think that's good because it saves on resources, keeps people from having to come to the emergency room if you can just go ahead and prescribe some stuff just in case. And it prevents extra phone calls to the doctor. So I couldn't get a hold of them, but I got a hold of the dentist that did the surgery, and I told them what had happened, and they were just in total shock. They couldn't believe how sick I had gotten. And I said, I have to have pain medicine. So they wrote some for Tylenol codeine, number 3. I've had that before. So I got that, picked it up, and started taking that. And that was what I needed, just kind of like get the pain to where it was manageable. But I was still, only got one little box. So I ended up having to get a refill on it. So there was that. So then I had another follow-up about a week after that. And by then it gotten a lot better. So they took out the drain and cleaned it out again. So basically I've kind of lost count, but I think I had 3 procedures where they had to go in, stick me with needles, anesthetize me. They had to inject stuff into my muscle back here because I couldn't open my mouth for them to work. I still can't open my jaw all the way. It's a lot better than it was, but I'd say I can open it maybe 65% of what I could before. So that's something we're gonna have to deal with later. Well, then I took all the antibiotics. I had, I kept having fevers. I forgot to mention one other thing. So then when I was in the ER, apparently I think I got COVID when I was in the ER and didn't know it. The problem was I was so sick from this other thing, I couldn't tell. And I thought it was a complication from the penicillin or the other antibiotic because I was having some soreness in the throat. But it just kind of stayed there. I didn't have any like major swelling. So I thought, okay, well, I don't know. Maybe it's the drainage from, this infection that's making like that. And then I started getting it was like symptoms of a head cold, mucusy and everything like that, and coughing. And then I realized, okay, no, I've got something else. And I thought back to when I was in the emergency room here, and there was people in there coughing and sick. So I think I got COVID from somebody probably in the hospital when I went in. And I think it was COVID because I even lost my sensation of taste, and I had like numbness in the tongue, and it felt like I had hair growing out of my tongue. It was really weird, but my tongue looked fine. So yeah, so there was that too on top of all this. So this has been a rather horrible ordeal. Then I've been missing work this whole time. So that was really tough, just sitting at home, not able to do anything. Another nice thing here in Sweden is, we have sick days. So I was talking to my mom about this, and she was really worried about me. And I said, the good thing is I'm getting paid for my time off. It's not the full salary. I think it's like the first day you don't get paid, and after that it's 80% of your salary. But this wouldn't have happened in America. In America, you have to purchase what's called like short-term disability, which is very expensive, and a lot of people can't afford taking that, making that payment every month for that. And so there's that. So my mom's like, yeah, you probably would have been bankrupt, like, if this had happened in America. So it's a good thing you're in Sweden, getting the care. So anyways, I went back in for my final follow-up appointment. That was Tuesday. And on Monday, I had been to the orthodontist because on top of this, I have braces. I don't have braces on the bottom anymore, but I have braces still on the top because I have a tooth that they're trying to bring down. And when she went in there to kind of check on everything, and I told her about what happened, and she gently pushed on the cheek, and a bunch of pus started coming back out again. I was like, great, it's coming back. So I went back on Tuesday, and they said, yeah, the infection has come back. So now I'm back on antibiotics again. I'm not on 2, I'm just on penicillin. So I'm taking those. I've got an x-ray next week on Monday because I need to find out, is there something else going on in there? And then I have a follow-up appointment a couple days later at the jaw surgeon next week. So that's where I'm at now. So overall, what are my thoughts? I would say I'm extremely satisfied with healthcare here in Sweden when it comes to going to the emergency room, the specialist, and that sort of thing. In my conversations with people during this whole ordeal and my experience as a nurse, the general thing I hear is Sweden is fantastic when it comes to acute care. It's also nice that everybody has access to it. It doesn't cost anything to go to the emergency room. So I just went in, they took care of me. I didn't have to worry about that. Whereas in America, I had very good insurance, and I still usually paid, on average per visit, I was paying about $700, after, the doctor had looked at me and, get your labs done and some fluids, and then you go home. So there's that. I don't know how I feel about the dental situation. It's concerning, but I do realize this could have happened in America. I don't know, but it's so interesting talking to people that work in the dental field in America, because they're like, oh, you should have had antibiotics before, during, and after, and you should have had pain medicine like the day of. But then you talk to people in Sweden that work in that field, and they're like, no, that's not the standard, because then you can get antibiotic resistance, and, they're trying to prevent that, and you could get dependency on pain medicine. And then I've talked to people from other countries. It seems to be Europe as a whole tends to be like Sweden, but then it seems like the rest of the world, like you could talk to people from Turkey or Lebanon or South America or the United States, and they tend to lean more on prophylaxis, like preventative measures. I don't know where I stand on that. I haven't looked at the data. I would love to one of these days be able to do that, or maybe there's some dentists that are watching this, or people that work in dental care. I'd love to have your feedback. I have no idea what to think about this. But aside from the dental care, I'd say everything else I'm super happy about. Just the bedside manner is fantastic. The speed of which I was treated, the respect that I got. And then when it comes to non-emergency visits, it's very affordable too. So for example, when I go to the jaw surgeon, it costs me about the equivalent of about $30 per visit. But then they even have like it's called like Högkostnad. It's like there's I don't know what they call it, Högkostnad begränsning or something like that. It's like a high cost limitation. So basically, once you reach about roughly $140 for the year that you spend on doctor visits, you get what's called like a free card. And so that means the visits are free. You don't have to pay after that. It's subsidized by the tax dollars. And so I have that now because I've had so many visits, so I'm good for a whole year. And then on top of that, they also have that with medicine. So once I hit $140, which I've done, then after that, my medicines, I don't have to pay for them. So that's my experience. I'd love to hear from you guys how it's been for you, if you've experienced healthcare in both systems, and what are your thoughts. Maybe you had a bad experience. Maybe it wasn't so good as mine. Maybe it was similar, something in between. I think when you get down to the end of the matter and you look at all these factors, what I really think is that there's good things in both systems. And I think there's no perfect system in this planet. And there's things that both systems can learn from each other. And so ideally, you would want sort of a combination of the two combined, some sort of hybrid system. I don't know what that would look like or how that would be implemented, but that's what I think. I just want to thank you guys also for all the support. I want to let you know I'm going to be completely transparent with you guys. I make about $15 to $20 a month off of YouTube. A part of it is I haven't been well enough or had the time to put a lot of content out there, but I have some videos that have gotten more views. But you don't get a lot of money from the ad revenue. So what helps me a whole lot, if you want to help me out, is make sure to like and subscribe and hit the notification bell for my videos. I have a lot of people that say that they benefit from this information and they had a hard time finding it. So please make sure to do that, like, subscribe. That way the algorithm sees that and will put this out to other people. That's the best way that you can help me out. Thank you again for all your support. Make sure to put your comments down the bottom. I try to answer all of them. If I don't have an answer, probably someone else that is here on this platform will see it and have an answer for you. Have a great rest of your day and take care of yourselves.